In October of 2014, I found that I had some blood in my urine. The urologist treated me for a tumor in the bladder that was non-invasive, but it didn't respond to the treatment. And when it went to the next stage, he recommended that I speak to the people at Hopkins. And I was able to get appointments with Dr. Hahn and Dr. Bivalacqua.
Bladder cancer has often been called the invisible cancer in that it's very frequent but has not had a voice for funding from national or other organizations.
Morning.
What was unique about Mr. Brill's case was in most instances we give the chemotherapy prior to surgery, and that surgery entails removing the entire bladder. There are a series of different reconstructions that we can do, but as you can imagine, that's a very significant life-altering event. Due to the specific location of Mr. Brill's cancer, one of the things that we were able to discuss in a multidisciplinary fashion was a potential bladder-sparing approach for him.
At the Greenberg Bladder Cancer Institute, we do our best to provide each patient with a personalized approach to the treatment of their cancer. Dr. Brill was a very active individual. He has a very busy dentistry practice here in Baltimore, and he did not want to have to deal with an external appliance. So we brought him to the operating room. We did a number of different tests to determine if he was a candidate for something called a partial cystectomy. This is where we remove only a part of the bladder in an attempt to preserve bladder function. In his case, he was a candidate, and we were able to perform a partial cystectomy with an extended lymph node dissection.
So at this point, Mr. Brill is doing very well. He achieved at surgery what we call a pathologic complete response, which means that after the chemotherapy was performed and when we had a chance to look at his surgical sample, we weren't able to see any live cancer cells left. While we are very happy to get our patients to a cured state, we never let up on the surveillance though. We believe that finding cancer early is the best chance to potentially cure it. So if we do see someone in follow-up and we see an early stage cancer, we want to stay on top of that and give them another chance for cure if they have a second cancer.
Buenas tardes, ¿cómo está? ¿Está bien? I look at it as a bump in the road. Of course, my wife looks at it a little bit differently, but everybody's going to get something sooner or later. Fortunately for me, I got it later, and fortunately for me, there were the people at Hopkins that knew exactly what to do and did it extremely well. I have the stamina that I had before, and all my hair is back. See how it's come, certainly? That'll go away.